thesis film is based in Ghana, West Africa. And it's a collision of, I think, a lot of different cultures. You got a collision of the Ghanaian culture, you have a collision of Western medicine, and how these all come together to try to solve problems such as infant deaths.
We were very fortunate to be the guest of a nonprofit organization called Cabela. And this was founded by Dr. Medj Owens. She's a Wake Forest medical university instructor. And Cabela is an institution that is basically trying to work in the field of infant and maternal health. And we found out that her organization wanted to have some video production done. It coincided neatly with the thesis track that we had already decided for ourselves.
And so, I mean, if you look at the enormity of infant death and maternal mortality in the continent of Africa as a whole, I mean, babies and mothers are dying at a very, very high rate. So now we're kind of zoning in on one situation, one hospital, where you have NGOs coming in, working together collaboratively in a respectful manner, and effectively making change and helping to save babies. So that's what we're trying to focus on and bring to light with the thesis film.
It's a lot about the process and the characters that are involved in the process of tackling some of these difficult problems that are all over, but we're looking specifically at what's happening at one hospital to be able to go deeper into the subject that way.
This kind of overall look, it is about culture change in two ways. You know, there's this idea that Ghanaian medical culture needs to change. The culture within the hospital needs to change in order to have the kind of outcomes they want to have. And yet there's this interface between Western and African culture. So it's about change, it's about culture, it's about saving lives.